Mental Health Awareness Month, and we are dubbing this a Mental Health Monday in a series where we encourage you to put the focus on your mind. Joining us this morning, clinical psychologist Dr. Corey Gonzalez. Dr. Corey, thanks so much for coming in this morning. We appreciate it.
Good morning, Maddie.
So we're not just focusing on this because it's May and the calendar tells us to, but the numbers say we really need to start talking about our mental health. The numbers of people who are suffering, often silently, are quite staggering. Can you kind of put those into perspective for us?
Well, Maddie, it's so big that we've had to come up with a new term called deaths by despair. And basically, it's comprised of people that die of drug overdose, which about 105,000 people died in 2021 from fentanyl. Basically, alcohol-related deaths and deaths by suicide. About 245,000 people, almost 250,000 people died death of despair. Just to give you another perspective, our younger folks, 30 and younger, our kids, between 20 and 2022, we lost about 7,700 people. In death by despair, over 10 times as many, 90,000. Wow. So we really have lost, it's been a crisis. We don't have the resources we used to have as far as the beds, the state hospitals. You know, back 50 years ago, we shut down a lot of state hospitals, hoping they'd go to community clinics, the antipsychotics would work. It didn't work. They end up in our prisons. We end up treating them there. And then about 6 years ago, they got pushed out in the streets. So we didn't want to, you know, there's sort of a deinstitutionalizing movement that's put them back out in the streets. And it's been a real struggle.
And I imagine, you know, the pandemic kind of accelerated a lot of the things that were already happening. You know, the disconnection, the lack of face-to-face, that just in-person connection with friends and family. And then the social media, which, you know, not only decreases the person-to-person interaction, but it has its own implications as well. But let's talk about some ways that you can combat this, because there are a lot of really good strategies out there. Let's talk about some of the coping skills that you can recommend.
Yeah, Matt, as you mentioned, a lot of loneliness, a lot of poverty issues, but yeah, one of the first things we need to be connected. And when I say be connected, we need to have, you know, connected to our friends, our families, our communities, our mental health specialists. And the Surgeon General, Dr. Murthy, recently came out and said, we need to have conversations with people that we care about and love or love us about 15 minutes a day. And we have conversations, put our phones down. We also need to manage our media, Maddie. We need to realize we're inundated with negative information from social media, the news. So we need to sort of feed our brain good food, you know, good music, comedies, and so forth. We need to develop interpersonal skills and conflict resolution skills. We have to know how to resolve conflicts without violence. You've seen way too much of this. Using good timing, good tact, good dosage. We also need to look at our way our thinking is. We need to get away from all or nothing thinking. We need to, you know, which we've done in our politics. We need to get away from overgeneralizing, emotional reasoning, get more toward gratitude, more toward optimism. Those are things that really help us. And develop an internal locus of control, Maddie. We don't want to be disproportionately affected by external things. The serenity prayer is a really good thing. You know, the courage to change things I can, right? But the serenity of letting go of things I can't, and the wisdom to know the difference between the two. Focus on attainable goals. We have to have purpose every day. We have to engage, put ourselves into something bigger than ourselves. And we can create these happy chemicals you've heard about, right? Endorphins, oxytocin from touching and play with our animals, endorphins from exercising. You've talked about rewiring the brain before, right? Self-soothing techniques. Meditation, deep breathing. When we meditate, Maddie, we build up the prefrontal part of our brain. It helps us to cope with anxiety. The Surgeon General said that the more we are detached from people, the more stressed out our brain gets. We're wired to be attached. And historically, it's meant if we're detached, there's danger. You know, back in the day when there's predators around, so we get stressed out. And we get so stressed out that we get inflammation. It's actually caused cardiovascular disease. Our Surgeon General said loneliness is equated about 15 cigarettes per day.
That's just mind-blowing, that loneliness is something like that. So when we talk about gratitude and meditation, those sorts of things, do you have any daily practices you recommend, like sitting down at the end of the day, writing out 10 things you're grateful for, or just like 3 deep breaths in the middle of the day when you're feeling overwhelmed?
Those are all great ideas, Maddie. Yeah, and I'm a real advocate of the apps out there, the Calm app, the Headspace app, Smiling Mind, but every day to try to get in tune to your senses. You know, try to get plugged into what you see, what you smell, what you taste. And the more you can sit with your thoughts, your feelings, your bodily sensations, the more you build up tolerance, the less reactive you are. So it's like building up tolerance to these things. Meditation is really important for our front part of our brain to be able to deal with our back part of our brain that's constantly shooting out anxiety and fight or flight chemicals. So getting grounded, meditation, journaling, all those things are really good for us every day because we're inundated with all this information saying threat and danger all the time.
Right. I mean, it's constantly with us. It's in our pocket. It's in our purse. It's coming from our phone all the time. And we're going to talk a little bit more about social media specifically and the implications it has on our mental health, because we could talk about that one in its own segment. So we're going to do that next Monday morning.
I look forward to it because it's pulling us away from each other. It's pulling us out of reality. It's pulling us away from our connections.
Right. Which, we don't want. Dr. Corey Gonzalez, thanks for coming in this morning. We appreciate it.
Always a pleasure, Maddie.